Thanks for being here for my talk today. So I did my practicum with the BC Centre of Disease Control, and my topic is on partner notification for sexually transmitted infections. So these are the slides I'm going to present today in the talk. So the purpose of my project was to do a literature review and environmental scan for the BC Regional Health Authority STI working group. The subject was partner notification methods that have been used to notify, detect, and treat reportable bacterial infections, STI infections, that affect sexual partners of positive individuals. So the objective was to review the current state of knowledge on partner notification and to provide information that will inform the provincial guidelines on that are going to be developed for STI partner care. So we currently don't have provincial guidelines on partner care. Oh, just to mention that the product or the outcome of the practicum was to collect the findings and provide recommendations and initiate the development of the guidelines. So a little bit of background on bacterial STIs. STIs represent a significant burden on the public health and are associated with significant population morbidity. STIs are the most common reportable infectious disease in Canada. And there has been a steady increase in prevalence of STIs over the last 2 decades. As you can see, the bacterial infections, chlamydia, gonorrhea, syphilis, have been steadily increasing in the graph there, whereas HIV has been controlled and has decreased. So the recent increases in STI infections have been due to a combination of factors. One of those are better detection and diagnosis at laboratories and also more patient awareness. The 3 bacterial STIs that have been mentioned here are reportable to the province by the medical health officer. Syphilis is also reported now on a national level. Chlamydia and gonorrhea, untreated, can result in significant complications for women, including pelvic inflammatory disease and an increased risk of HIV for both genders. Syphilis, untreated, can cause heart disease, blindness, CNS damage, death, and perinatal death in pregnant women. Currently, the majority of people infected with syphilis are males at this time. So partner notification is the process of identifying and informing partners of individuals diagnosed with an STI of their potential exposure to an infection and to encourage testing and treatment. Partner notification is voluntary and anonymous, and it recommends safe sex behavior practices. On a public health level, partner notification can greatly reduce the risk of index patient reinfection and prevent further spread of infection. It is critical for asymptomatic or latent infections, especially such as chlamydia or syphilis. So the methodology used was a directed integrative literature review. It's a mouthful. The review method includes both experimental and non-experimental research and literature from directed sources such as public health agencies, national institutes of health, and research and regional health authorities, and also unpublished gray literature. The directed sources focused on systematic reviews and health agency guidelines, such as those found on by PHAC, NCCID, and regional health authorities. My supervisors were very helpful in directing that aspect of the literature review. The database searches that I used focused on recent studies conducted in the last 10 years and included search engines such as PubMed, Cochrane Collective, Embase, Google Scholar, etc. I used mesh terms and a set of inclusion-exclusion criteria. And I found that this method is well suited for guideline development, especially when equity is a component of the guidelines. The findings were all compiled into a literature review table to capture all the documents reviewed. So the findings were that I reviewed over 80 documents, including guidelines, systematic reviews, qualitative studies, and RCTs. The findings I divided and summarized into two main categories. So the partner notification approaches can be categorized into provider referral and self or patient referral. Provider referral is when the healthcare provider does the notification directly, and patient referral is when the patient takes the responsibility to notify their partners. There are different ways of doing that notification. There's simple notification where the patient verbally tells their partners of the exposure, or there's an enhanced notification where the patient will provide literature, referral notes, requisitions, etc., to their partners. And then there's PDPT or EPT, which is when the patient can actually provide therapy and medication to their partners. So the promising partner notification practices were further analyzed based on the method of notification used, the population-specific findings, what worked better in different populations, disease-specific approaches, so certain aspects of notification worked better for certain diseases, and other approaches that worked, for example, in high-risk environments or using social policy interventions to make the notification more appropriate. I also found that there were barriers to partner notification, including risk of physical or emotional abuse and the prevalence of anonymous partners, which is a problem for partner notification. The areas for development I found were partner notification using the internet, and patient-delivered partner therapy was another area for development. And enhancing access to STI services for youth, Aboriginal populations, and rural populations was an area that could be developed. So the recommendations that I drew from the literature review were that, firstly, that partner notification guidelines need to describe a variety of methods and options to support effective notification programs, and should recognize that there are unique factors of key populations and structural barriers to STI care. The second recommendation is that a framework for evaluating partner notification programs in BC needs to be developed, and ideally this should target, it should include target indicators for numbers of partners contacted, tested, and treated, and this will help evaluate the effective methods of notification out there in the general population and in key populations. And it can also help measure equitable partner notification services. Then the final recommendation was that to further research in the area, we should look at assessing the impact partner notification programs have on behavior modification for safer sexual practice, and to identify structural barriers to STI prevention so that you can tailor programs that will work, and also to monitor the population incidence of STIs in order to evaluate whether interventions have worked or not. Some of the limitations I found was that there is a lack of new research based in North America on programs and partner notification. There was a potential for selection bias in the research because there's a very few systematic studies done, and mostly they're all based on observational studies. There wasn't a cost analysis included in the scope of review, and that can really impact significantly on your health program, what's possible logistically and what's not possible. And then some of the challenges and strengths I found was that the literature review included 3 distinct diseases, so that's a lot of multiple factors identified that affect disease transmission. So it was a challenge to incorporate all of that into one overarching recommendation. But a strength I found of this project was that I was able to identify some next steps, and including recommending that community needs and community consultations take place to help design the guidelines. In terms of health inequities, there is a risk of unintended harm and exacerbation of health inequities that can result from STI programs. It has been shown that health systems can perpetuate barriers to care. And I think to challenge that, to deal with that, community consultations on programming and community needs can identify barriers and strategies to help overcome health inequities. In terms of implications for public health, partner notification is effective to enhance prevention, control, and surveillance of STIs, and provides the strategies to address the increasing prevalence of STIs in Canada. So in conclusion, the Practicum project provided the BC CDC, clinical prevention services, and the STI working group with the literature review findings and recommendations, and initiated the working group meetings. These are the references that were used in the presentation. And I'd like to thank my supervisors, Dr. Jason Wong and Cheryl Prescott, who is a former graduate of this program, and also Professor Kathy Worthington and Michael Hayes, who were my reviewers, and also Paige Muttersbach for providing me feedback on the presentation. And thanks to my family for being here, for supporting me through this. Any questions?
Thank you.
Hello. I'm just wondering if the role of stigma came into your literature review, particularly like the patient referral methods, and if you have any ideas of how maybe you would combat that?
Yeah, stigma is an issue. I mean, it is a barrier in partner notification. It's also a barrier to accessing healthcare and, having STIs diagnosed. That it is definitely a barrier. It's something that the healthcare field is kind of working on and learning and trying to overcome those barriers. And also, community consultation is something that I feel will help identify and maybe tackle the stigma and try to provide care in a way that's acceptable to diverse communities.
Hi, I'm Bethany. Are you familiar with the new Get Checked Online initiative?
Yeah.
How do you think, for those of you who aren't familiar, it's an anonymous way to get STI testing? You can go to this website, put in your information that's anonymous, and then you're given a printable health rec that you can go get tested. But how do you think that system can integrate with effective partner notification systems?
Well, there are internet-based partner notification programs that are out there and that are coming up where you can anonymously notify partners using a web-based program, and so you can be anonymous, but you do have to have contact information though for your partners. So you will have to have an email or a text number where you can send them a notification to say, you're at risk and you should get checked. So those are one of the areas that have been highlighted to develop further.
Good. Well, thank you very much for an excellent talk.